Without further ado, I'm going to bring Erica back so she can introduce our speakers.
I'm going to have our speakers introduce themselves to speed up time. So, Baba Keely.
My name is Keely. I'm with Black Lives Matter LA and the Fannie Hamer Institute. I'm here with Black Lives Matter members Michael Hobson and Camille Lewis. And we are here to make sure that there is affordable, accessible, universal health care for all Californians, specifically Black Californians. And the best way to do that is with single-payer health care. There are 15 million Californians who either don't have health care or underinsured. Many of those 15 million, a third of them are Black. Having a single-payer healthcare system is the simplest, affordable, best way to make sure that all Californians are covered. So we're here today to support universal healthcare, universal access, and universal support. So we are looking forward to single-payer in California and ultimately throughout the country. Thank you. Sure, too.
Hi, I'm Jamie Penn. I'm one of the people from the Wilshire Center Koreatown Neighborhood Council. I serve as Executive Vice President. I'm out here in West Hollywood today because it's extremely important that we support CalCare and AB 1400. There are currently 3.2 million uninsured Californians, and there's actually 12 million underinsured Californians. And the COVID-19 pandemic has only made the disparities worse. So by affirming healthcare as a human right, we can eliminate waste, because study after study has shown that single-payer healthcare with comprehensive coverage would actually offer a massive savings. And when we think of the massive savings, we just can start to imagine what could we do with those freed up resources. So I just want to stress that we could provide better healthcare coverage and do so for less money than our current system. And by simplifying healthcare system, healthcare would save billions in administrative costs. It would allow us to negotiate prescription drug prices and provider payments on a statewide basis. CalCare would be able to lower the prices of drugs and healthcare services, and that would result in substantial savings overall. Again, more resources for our communities. We deserve a system that works for us. We deserve patient care based on patient need. So we deserve universal coverage. We deserve CalCare, and we all support AB 1400.
Hi, I guess I should start, right? Hi, my name is Zikr Force. I'm here representing Red Berets. So Red Berets are solidarity organizers in healthcare justice movement. Started out in Washington State, but we are expanding nationwide because we feel the great need to support and connect all healthcare justice organizers and activists across the nation so that we can win state by state and eventually get Medicare for all in this nation. So what I want to say today, I want to say two things as a Red Beret and also as a person of color, immigrant, Asian, and transgender person. So first of all, thank you so much everyone for being here. I'm so honored to be here with all of you. And I can confidently say, we can do this, California. California can lead the way. And as we Red Berets like to say, open the floodgates. By realizing single-payer healthcare statewide, by state, we will open the floodgates and promote and motivate people to advocate for Medicare for all at the federal level. So that's what I believe, and I'm really excited to be here. So as an Asian person though, AB 1400, I have really great hope and actually really, really, feel very much honored to be here in California because it's a great bill. It provides culturally sensitive, culturally appropriate care for all people, and which is very important, which is the part of healthcare that's very overlooked in the mainstream, sphere, I think. So, for instance, Japanese American community during the pandemic experienced eviction of seniors in this particular senior care facility because the ownership was transferred to for-profit company, which wanted to evict all the seniors in favor of more profitable, more lucrative business model. So, that kind of thing won't happen under AB 1400. And also, I just want to emphasize, culturally sensitive, culturally appropriate care is actually a matter of life or death, not only for people of color, immigrant communities, but also transgender LGBTQ communities as well. People don't realize that, like for instance, like having a caretaker speaks your language or having, food options that you are familiar with, an Asian person or, any immigrant, actually is not an extra thing. If seniors have food that they're not familiar with, they'll stop eating, and that's a matter of life or death, right? So, AB 1400 will gives a culturally appropriate care, which is, which we really need. So, in closing, I just want to emphasize, as Jamie pointed out, to the undocumented populations in California will greatly benefit from AB 1400 as well. And that's like really dear to my heart as an immigrant. So thank you so much. Let's do this. Let's make it happen, California. Thank you.
Hi everyone, Kenneth Mayer here. I'm a certified public accountant and also a housing justice activist running for LA City Controller on June 7, 2022. Woo! Here to advocate and support AB 1400 CalCare. Woo, 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 woo. And AB 1400 would benefit taxpayers here in LA tremendously. I mean, the city of LA, we pay about $840 million a year for our city employee health insurance, which goes to Aetna, goes to Kaiser, and we know the CEO of Aetna makes $17 million a year, and they make $6 billion in administrative revenue, like on administrative costs. So, we could save a lot of money. And in the fact that in LA, over 500,000 people don't have health insurance, and CalCare takes care of them. And then there are probably a lot even more who are underinsured who don't even want to go to the doctor to get visited because of the cost. So we need to fight for AB 1400. And, me, our campaign, and our team are here 100% on board because we believe that healthcare is a human right. Thank you.
Woo! Thank you so much. Wonderful speakers. Thank you. Everybody vote Kenneth here for controller. Okay, I'm going to close this down, and then we're going to have a few logistics announcements from the show, and then it's wheels up. So I want to thank all of our volunteers, the Community Solidarity Project, Healthcare for All Los Angeles, Red Berets, DSALA, Hands Off Cuba, all the incredible organizations, volunteers that are too many to name, but thank you, love you, appreciate you. You guys made this happen. If everybody could just take a moment and close your eyes and take a deep breath in. Hold it, exhale, and center yourself in yourself, and imagine what CalCare would do in your life for you. What would it mean for you if you had all your medical from birth to end of life, all your mental health, if you had all of that paid for, the highest quality, the same that the governor's getting, how does that make a difference for for your family members? How does that make a difference for your community? We have the money. We can make CalCare a reality. And that's what you're here doing today. So much love to all of you. And with that, I'm going to bring up Michelle Manos for logistics and then start your engine.